Today's expert is Dr. Tyler Arvig. Dr. Arvig is a clinical psychologist and associate medical director for R3 Continuum. He has over 15 years of domestic and international experience in behavioral health and workplace absence. He is an engaging public speaker who regularly presents at national and international conferences and to large and small organizations on work absence topics and clinical issues in the workplace. He has experience training and mentoring physicians and behavioral health professionals. Dr. Arvig has authored several peer-reviewed journal articles and is frequently cited as a subject matter expert. He's also a high-performance driving instructor, racing enthusiast, and a very slow auto mechanic. Thank you for being with us today, Dr. Arvig. Past 2 years, I'm sorry.
Go ahead, Shane.
The past 2 years, we've all learned about the importance of mental health and how mental health can play a crucial role in the workplace. It's important to always be learning about new trends and ways to improve mental health for your employees. Dr. Arvig, can you start us off today by talking about the current landscape in the workplace?
Absolutely. And let me see here, Shane. I might need to refresh my screen. This is the technical issues that shouldn't happen at the beginning. Did you change the slide?
Yes, yeah, the slide has changed. So just refresh it and we should be good. It should update any second.
All right. Let's see is it going to drop me off if I refresh it?
Nope. If you do, it'll hold you for just a couple seconds and then you'll be back.
Give me a second. Sorry if I get interrupted.
That's all right. Technical issues happen. We've been around this for a couple of years. I think, everybody's experienced this a time or two before, and hopefully you all can bear with us. So thanks for that.
Are we back?
You're back. You're seeing slide two?
The correct slide. It's a miracle. Thanks everyone for hanging out with us. Every once in a while we have that glitch where for the presenter it doesn't switch over. So I'm glad we were able to get this done and functioning. Like Shane said, we have a lot to cover today. This is all really important stuff. And if you've seen us present or me present before, some of this might seem like stuff you've heard before. And it's because you have. But some of it's new. And a lot of it, our situation has changed. So it behooves us to really think through this again in terms of, okay, that's what it looked like last year. What does it look like right now? So like Jim said, let's start out looking at what's the current landscape for kind of personal stress. What are we dealing with as a workforce? In some ways it's better than it was. In some ways it's not. So some of us have benefited from being able to work from home. We started to adapt to some of the changes. It's becoming normalized for us now. And so the acute stress that might have been there before might not be there. At the same time, some things have drug on for quite some time. And they're grating on us, they're wearing on us. And so, that piece of it is just continually a struggle. And sometimes it's like it seems like things are getting better, but it doesn't feel like things are getting better. And that's where a lot of us are right now, a lot of our employees, a lot of our people. I should be feeling more positive, but maybe I'm not. Or maybe I am and I feel a little bit guilty because some other people are having a harder time. So just things to be aware of. We're all getting a little bit tired in this experience. The other thing we're seeing is, depending on where you're at in the country and in the world, we're seeing more of an attitude towards I don't care anymore when it comes to, like things like travel or other things that we wouldn't have done because it would have been perceived as too risky. And now we're just kind of doing things because we can. Going out to the bar on a Friday night. Well, I've not done that for the past year and a half or 2 years, and doggone it, I'm going to do it now. So there's a sense of we're just letting loose because we can. Maybe there's a sense among ourselves and our people that, what does it matter anyway? I'm not wearing a mask. What does it matter anyway? If it happens, it happens. One of the things about, prolonged stressors for us, for humans, is, we can do that kind of holding it together, white knuckling it for a little bit, but we can't do that forever. At some point, it's going to start to become unsustainable. And so then we start to do things that maybe we shouldn't do or we wouldn't have done before. That's just human nature. At some point we can't, it's like, all right, well, I've been not going out, but I'm really not willing to do that anymore. The other thing that's, I think, pretty significant is, non-pandemic factors, and I say pandemic in terms of illness, not pandemic in terms of the social situation, are starting to hit folks. Things like, the economy, inflation, some of those kind of things. So everything costs a little bit more. Everything's a little bit harder than it used to be. So that's kind of where us and our people are at right now. And we just got to be aware of these things as we're talking through these other topics today and going forward.
I think it's interesting too. Like it's the little things, like you said. I mean, we've been in this for so long. I mean, now it's 2 years. It's crazy to even think about that. But just even going out for, a dinner, with Valentine's Day yesterday, it's like just going out is part of me was like, hey, we deserve it. We can go out and everything like that. And then we got there and I was feeling stressed. It's like, here we are in still kind of an unfamiliar territory. So I think it's affecting everybody in a lot of different ways. And I think that it really is impacting people, a lot, especially the longer we kind of like go on here.
Yeah.
So why don't you run us over some of these stats here, Tyler?
Sure. These are not going to be surprising to anyone here. I'm not going to spend a lot of time on this, but the sense that mental illness is becoming more common or more prevalent is not just a sense, it's a very real thing, particularly anxiety and depression for understandable reasons. Also included in this is we're seeing, and we have seen increases in substance use and increases in things like, overdoses for drugs and some of those kind of things. Because it's what, some of those things are ways that we try and deal with, increases in stress and anxiety and depression. So, among your workforce, assume that there's a massive increase in those couple of things. And, most of your workers, probably this statistic is 78%, my guess is the actual number is higher, feel like an employer has some responsibility to help them with the mental health effects they've been experiencing over the past couple of years. And we're going to talk about that more later. But again, this is stating the obvious, but still need to be aware of it.
One thing I wanted to bring up while we're kind of on this page, and I think we talked about this a lot when everybody first started kind of working remote. But do you think that working remote has had an impact on the mental health of folks? Yeah,
it has. Well, for some folks. Working at home, they're happy as a clam working from home. That's what they've always wanted, and they love it, and they don't need to get out of their pajama pants, and it's great. For some folks, working from home really wasn't that great. It depends. If you're a single individual, it can be isolating. You're not engaging with other people that you normally engage with during the day. If you're not a single individual and you have a family like I do, you're dealing with other distractions and stressors as you're trying to do your normal workday, where you wouldn't normally be trying to manage things at home and do work at the same time. And then there's folks that are just in unhealthy home situations, whatever it happens to be it addiction or abuse and some of those kind of things. And honestly, for a lot of those folks, going into the work site, whatever that work site happens to be, was a nice respite from some of the day-to-day difficulties that they might be experiencing. So working from home clearly has had an impact on some folks' behavioral health. Some of them have been impacted positively, others negatively. And of course, we have to remember that while a lot of us have the luxury of working from home, the majority of workers don't have that luxury. And so working from home was never an option for a retail worker or a hospital worker, a direct, public-facing manufacturing, whatever it is. So I think sometimes we start thinking in this bubble of working from home, like everyone's able to do it, but the reality is most aren't able to do it. So yeah, clearly lots of effects. The other thing I just want to touch on very briefly, because I want to move on, is just because the COVID-19 situation is improving and hopefully will continue to improve, and at some point will not be a significant concern in society, we hope, doesn't mean that all of these things I just talked about, the addiction, the struggles with anxiety and depression, those kind of things, are going to go away, because they have been entrenched. They've become entrenched for the past couple of years. And mental health conditions don't work like that. They don't just go away when you take away the stressor. So we need to be operating on the assumption that, yes, those people need to support in the middle of 2020. They need support right now, and they're probably going to need support next year at this time, even if things seem like they are reverting back to how they were pre-pandemic.
Right. So then, just off of what you're saying there, can you kind of give us some more insight into what's going on in the workplace?
Yeah. And there's always new statistics on these particular issues, and this is not this is not the be all end all of workplace statistics when it comes to these things, but this paints the picture, so that's why I have it in here. Most all companies made some changes to their human resource policies in response to COVID-19. Despite that, very few employees actually felt supported by their employers, 1 in 6. And again, the majority of employees considered mental health to be a top challenge, and particularly among women, that mental health was really a primary concern. Again, as much as we talk about our fear of getting sick and our fear of, catching COVID-19 or whatever it happens to be, the mental health challenges for most people are the more threatening, more real of those. So just, again, things to be aware of as you're dealing with your folks that, while most companies have tried, at least on paper, to do the right thing, it hasn't always translated to your employees feeling supported. So maybe some of those changes haven't been operationalized as well as they should be. And we're going to talk about that in a little bit as well.
Yeah, and I think what you said there is really important, because while, people are trying to get ahead of it, they're trying to implement these different things. There's different ways to support that change. I mean, there's different services that pop up. There's more companies that are realizing the importance of all this, and they're providing more support. And it's a constant changing thing. So it's always good to kind of stay on top of everything that's happening. Because obviously, 1 in 6, you want that to be a lot higher of a number of employees that feel supported, and making sure you're providing the resources that work best for them is definitely the way to do it. I know, like you said, we will be going in that in a little bit. So can you talk to us a little bit about what the consequences of having an impacted mental health has on employees at work?
Yeah. These, again, should not be surprising to anyone in this audience, but I do want to highlight them because we need to be thinking about them. Every day we need to be thinking about these things, because these are the things that are keeping your business or your organization from moving forward, and they're keeping your employees from being productive and engaged. And people that aren't productive and aren't engaged are going to go find something else. So decreased productivity, we're probably all pretty familiar with that. The old joke that I can't take credit for is how many people work at your organization? Well, about half. But half of your people aren't as productive as they should be. Presenteeism, again, I'm showing up for work, but I'm not getting stuff done. Absenteeism, I'm just missing a lot of work for, I'm just not feeling motivated, I'm not feeling well, those kind of things. Resignations, honestly, we're seeing this in droves right now. The term that's been coined, the Great Resignation. People are leaving. And the interesting thing is some of those people aren't leaving for other jobs, they're just leaving, period. which is always a bit of an interesting situation to think about, that, you know, there are people that will just leave a job without having anything else lined up. But this goes to show how significant some of these impacts are, that I'm willing to forego income because I'm not feeling supported in that work environment. And obviously decreased morale, which contributes to all three of the above as well.
Yeah, I think, you know, we've talked about this a number of times. You know, I think a lot of these contribute from burnout, which is a word that I know, you know, it's so relevant right now, but it's from stress, which we all know stress is kind of an issue that everybody is having. And we're just seeing more and more of this. So I think, you know, our next slide here kind of is going to go over a poll that we'll have everyone answer real quick. And I think it's going to be really interesting to kind of see what answers we get from here. So you want to go over what we're going to ask in the slide here?
Sure, pretty self-explanatory, but I just want to get the audience's perspective. What things are you seeing right now that are concerning in your work environment? Changes in productivity, increased absenteeism, depression, anxiety, concerns about suicide, hopelessness, concerns about work-life imbalance, conflict, safety concerns, or maybe you're not seeing any of these things. And I think you're able to select as many as are applicable. So Shane, why don't we move ahead, or go to the next one and allow people to, we'll give folks a few minutes to check all those that you're seeing, and then we'll look at the results and talk about that.
Yeah. Feel free to click, you know, any of them that you are seeing. Like Dr. Arvig said, you know, you can choose all that apply. I see some coming in from the comments here, which is awesome. I appreciate that. I see, you know, one right here, all of the above. It's kind of crazy to think about that it's, you know, we see so many different people that are affected in so many different ways. So it'll be interesting to see what kind of results we have, and we'll go over those in just a moment once we kind of get all of the answers in here. And I think it's also interesting remote. Dr. Arvig, maybe you could talk about this briefly while we're going over it, but remotely, I feel like at the beginning, everybody was kind of like really, they made sure their backgrounds were all spick and span and things like that. And seeing little things change could show kind of the impact that people are having at home. You know, maybe a background they have clothes from 2 weeks ago that are piling up in the back or anything like that.
I mean, I do. You just can't see the cameras angled up enough. So, I mean, you do notice those things, and there are things that we see when people are in office that we don't see when they're working from home, and then there are things you see in your coworkers because they happen to be working from home. And it's interesting, but those are things to be aware of when you're working, particularly with employees that you might supervise, when it comes to how to identify folks that might be struggling or might need some help. Should we flip over and look at the results?
Yeah, sure. So we will flip over. One thing I want to say before we go on is that we did get a comment in here that, just going back to our last one, is, you know, lack of motivation has been a big issue for many people, including the commenter. And I think, you know, we'll see in a second what the results are, but absolutely, that's huge right now.
Yep. Thanks for sharing. Okay. So this is pretty consistent. You know, I've used this poll a couple different times over the past couple of years, and I think this is pretty consistent with what it's been. I think when we used this poll, maybe Shane 6 or 9 months ago, I think this is pretty consistent. So most are seeing some concerns regarding anxiety. Looks like the next biggest one is work-life imbalance. Not surprising. Changes in productivity. Yeah. Workplace conflict. Some workplace safety concerns. Quite a few had that. 10% noted concerns about suicide. And that is, you know, not, I'm glad it's not 10%, not 70%, but 10% is quite a bit. Just things to be aware of here. Increases in absenteeism, and almost no one said things are the same. So clearly our workplaces, our work environments have changed. I just want to touch on, you know, most noted a concern about work-life imbalance. And it's interesting because this issue has evolved over time. This was always a concern, you know, work-life balance has been a topic for eons. And in the like Gen Xers or baby boomers more so, it was, there is no work-life imbalance. I'm going to work till I die and then I'll be dead, so it won't matter. And then, you know, later generations came along and you know, balancing out became more of an issue. And now we have people that are working from home, which we all thought was the magical elixir to work-life balance. Well, if we're working from home, I can attend to both, and I'm not going to spend all this time commuting, and I can talk to my kids or my wife or my boyfriend or whatever during the day. And it's, but for a lot of folks, what it's turned out as is my work day is longer, and I don't really ever shut it off. And if an email comes in at 6:30 at night when I normally wouldn't be in the office and want to pay attention to it, I pay attention to it. And if any of you saw my Dr. Bergolius' presentation toward the end of last year, he talked about trends in 2022. But numbers in emails and messaging and all that kind of stuff has spiked over the course of the pandemic. So people are busier. So actually work and life balance is harder to achieve now, even though it seems like it should be somewhat easier.
Yeah, I think.
Yeah.
Oh, I'm sorry. Keep going.
Go
I
ahead,
was just going to comment on work-life imbalance. I think it's interesting that it's so high. I mean, it makes sense to me that it's so high. Just like you were saying, you never really seem to leave work nowadays, especially if you're working remote. But I think it's interesting because when everybody started to work remote, I think the concern was that nobody was going to ever do work. And now we're seeing people are on more than they are off. And I think that kind of that kind of might lead into that stress, you know, because you're never really letting go. You know, you leave the office on a Friday, you don't have to go back until Monday. And now it's like you leave the office, you go out those doors right there. And then on Saturday morning, you're walking past and you're like, oh, you know, what's over here? This is work. You know, I feel like you just kind of never leave.
Yeah. It is, and you know, if you have employees that are struggling with that, there are certainly things you can do. But one of the things you can do is make clear expectations about when they're working and when they're not. If I send you something, I don't need you to respond right away. Save it till the next day. Having a separate working environment, if you can. A lot of us can't. You know, a lot of us are using a space that works for multiple things. You can train yourself to shut it off, but it's work, and a lot of us haven't gotten good at that, myself included, frankly. So I want to move on and talk about what we have on the next slide here, Shane, because it kind of dovetails into what we just have been discussing.
Yeah, absolutely. So, you know, mental universal needs. Let's dive into it.
Yeah. So, you know, most of us are not behavioral health professionals, but we all actually have a pretty significant role in the health of those around us. And if I'm a manager or a supervisor or a leader, there's some stuff I have to understand about basic human psychology to do my job effectively. The joke, it's not a joke, but the point I often make is a lot of leaders don't get promoted to positions of leadership because they're good at leading. They got promoted because they were good at their job, and they're like, oh, you should run this. And they have very little skill in managing other people. Now, a lot of us develop that when we need it. Some of us get additional training and take additional time to develop that skill. But being a manager, being a leader is not about getting your people to do stuff. It's about supporting them so that they can do stuff. You know, if you're giving directives and just telling people what to do, you're not really leading, you're telling. So one of the things that behooves us to spend some time on is thinking about what people need. And this doesn't just apply, this applies to ourselves as well, right? But there's some basic human needs, and you might say, well, human needs, you know, work is work. I don't care about your basic human needs at work. Well, you should, because these things are going to apply in a work environment. People need to feel successful, right? They need to feel like I accomplished something, I did something, I made a difference. They need to feel accepted, like they are part of something, and like they are valued within that something. They need to feel significant. Again, I'm not just a cog in the wheel. I'm not just employee number 754. I'm Shane, I'm Tyler. I have value in this organization. What I do is appreciated. And then needing to feel fairly treated. You know, and this is always a tricky one because, you know, I tell my son, you know, there's no such thing as fair, right? Like this isn't everyone has exactly the same amount of challenges and you get no more or no less. But certainly, like, you are being treated appropriately and with respect and dignity. And if your employees are not able in the work environment to feel and experience these things, or one of these areas is really lacking, they are likely to struggle with what we talked about in the previous slide regarding presenteeism, absenteeism, resignations, and all of those kind of things. So if you have an employee who is struggling, I would just sit with this slide or these 4 categories for just a minute to yourself. Think to yourself, okay, does this person feel successful, accepted, significant, and fairly treated? If you don't know the answer to that, ask. You know, there's nothing wrong with asking. And if you find there's a deficit in one of these areas, think about, is there a way I can change this? Is there something else we can do differently so that your needs are being met in the work environment, so you're more fulfilled here and happy here?
Yeah, I think those are all excellent points, and I like the idea of, you know, connecting. I think that, you know, asking how somebody is doing is important. I think it was with you, or it was either you or Sarah Hathaway on one of our last webinars. You know, we discussed how important it is to communicate, to be open as a leader, to having conversations with people that are you know, you don't know how they're feeling, but you got to kind of like check and see. And sometimes they will be more open to letting you know how they feel through that. So I think that's an incredibly important point.
Yeah, that's a great point, Shane. I think sometimes when we connect with our people, we get right to, like, hey, what's the issue? What's the problem you're having? We don't spend, excuse me, and maybe this is the case more now so that we're remote or we're more scattered, but we don't have those natural brief interactions where I see Shane walking in with, you know, something in his hand that is, you know, funny or whatever. We don't have those natural connection interactions as much as we used to. And, you know, if it just becomes about getting stuff done, we're not getting those connections, that need for connectedness met. And I think we're all getting pretty good about things like, you know, certain platforms, whether it's Teams or Zoom or whatever. And that helps us feel more connected. But always be thinking through, because people feeling disconnected in the work environment is going to lead to people disengaging in the work environment. And people that are disengaging in the work environment are going to be less productive. So that connectedness is not just about helping me to feel better emotionally or, you know, about myself. It's also about having a more functional and effective work environment. So to move on, you know, the question I often get is, how do I know if one of my people is struggling? Like, what are the signs? And the short answer is, I can't tell you that with any level of certainty because it's going to be different. What I'm looking for in most instances are changes. Okay. If Shane has been this way for the past 9, 10, 11, 12 months, and then all of a sudden something changes. It might not be, good or bad, just a change, something that's different. That's not necessarily an indication that something is wrong, but it is an indication of, maybe I need to check in. If you see people start to, I'm later for meetings than I used to be, or I'm not as focused as I usually am, or it's not always obvious things, but it might be. It might be someone breaking down in tears. That's pretty obvious. We can go, okay, something is wrong there. But someone showing up late for meetings, or someone, kind of missing deadlines they don't normally miss, or those kind of things. And it doesn't mean that we approach them and go, hey, what's going on? Or what's wrong necessarily. But hey, I've noticed a change. Is everything okay? And if there's nothing wrong and everything's okay, they're going to tell you that. But if there is something wrong or they need help with something, they're going to tell you that too. So when you're trying to identify people that are struggling, we're looking for changes. Changes in mood and behavior, and this might be somewhat obvious. When people verbalize things, that's obviously a pretty good indication of someone, started to call the stressed, or I'm just overwhelmed, or I can't get, I'm really struggling to get into it. Don't just go, that's too bad. I'll do this thing. Take a few minutes to dig into that a little bit. Obviously, changes in productivity or attendance, changes in engagement. Maybe they used to do a little more idle chit chat, and now they're just down to business, or they don't have the camera turned on as much as they used to. And then clearly, if folks are doing something like verbalizing a sense of hopelessness, that's something we also want to be quite aware of. When it comes to suicide, the biggest predictor of suicide from a psychological standpoint, if you look at people that attempt suicide or complete suicide, hopelessness is the number one common factor for those folks. If I feel like there's no hope for tomorrow, that's a major risk factor for suicide. So if people are expressing to you a sense of hopelessness, or I can't go on, or I don't know why it's worth it. Those are things that I really want to hear, and I really want to ask about and try and support folks.
I think we have one comment in here that is pretty relevant to this slide. Mm-hmm. I think we might actually be going over the next one, so we can move ahead if you would like. But the comment is, what if the employee doesn't respond?
Good question. And I know asking a follow-up question is hard in this format. But when you say don't respond, I guess I'm not sure if you mean like you reach out to them and ask for help and they never get back to you, or they just kind of blow you off.
I would kind of assume kind of like the blowing off, or that, they maybe, you could tell that they're just kind of giving you a fluff answer or something you maybe want to hear, but they're not being very truthful with you.
That's okay. It's going to happen. And here's what I would say about that. If they're giving you a fluff answer and you think there's something else there and they're just not wanting to tell you, I want to look at first, how am I approaching it? So if there's a perception that I am kind of a straight shooting, to the point, not real supportive type manager, and I've never asked you about your feelings before, and then all of a sudden I ask you something personal, I'm not going to tell you much. I'm going to brush you off. I'm going to sweep it under the rug, because I might not feel safe with that. So really, the one thing you can do to try and prevent that is to come at it from a sense of, I genuinely care. And this doesn't mean being their therapist, and it doesn't mean crossing personal boundaries. But it does, and I think, Shane mentioned this earlier, it does mean, being a little bit vulnerable as a leader. And, sometimes the other way you can get at that is, let's say you think someone is struggling with their children at home and they're struggling at work because they have 3 kids at home that need constant attention, and you have kids at home. One of the, you can say, I'm just wondering, is everything going okay? I know that you have kids at home, and I got to tell you, I have kids at home, and there are days when it just drives me nuts. Like, I really struggle. And if there's a sense of you're going through the same thing, maybe they're more willing to be open with you. Now, if they're not, look, that's their prerogative to not answer your question. And if you come at it from a place of genuine support, then, maybe at some point that will change. Now, if you have a significant concern about an employee and they're not willing to open up to you, and let's say the concerns about their safety or something like that, then you probably want to go down the road of contacting your HR or some other avenues if you feel like there's a real safety concern or something more serious beyond, just struggling a little bit getting stuff done. Certainly. But I hope that answered your question. If not, feel free to, I'm happy to address a revised version of the question if it comes in. So.
It sounds like that it did come back, and it was kind of at exactly how we kind of covered it. Of what if that employee is just kind of saying, "Yeah, they're okay," after asking. So I hope we covered that, and it looks like they said, "Yep, it did." So perfect.
Good. And Shane and I are from Minnesota, so we are the masters of asking questions and getting stock answers. And like, "Hey, how's it going?" And if I said to Shane, "Hey, how's it going?" and he went into, "My dog died and my girlfriend's mad at me," and this, I'd be like, "Oh, I really didn't want to know all that." So sometimes it's how you ask things. If it seems like a stock question that deserves a stock answer, you're going to get a stock answer. If you're really curious and you want to support that person, think about, how am I asking the question? You might be more likely to get a more productive or meaningful response.
Yes. So kind of actually going off of that question, what can leaders be doing right now? We've covered a few of these, but, why don't we go a little bit more in depth with it?
Yeah, let's do it. So here's, and these aren't in any particular order. The first thing you can do in your organization is make behavioral health a priority, make employee health a priority, not just at the HR level or at some, the wellness committee level, but at the very top. Your C-suite folks, your president, them indicating, we have a business to run and we have things to do, but we care about you too. And checking in and showing that it's something that's not just on paper. Like the previous slide, 96% of companies made a change in HR policy. Most still didn't feel supported. And we often look for HR to be that support, and they should be, and that's wonderful. And we want them to do that. But we also want our leaders, people that hired us, that support us, that run our businesses, to say, hey, this is a priority for us too. The second point, engaging your employees, we already talked about, but really, how do you communicate with them? Don't just do it in emails. Do you call them? You call them for no reason. You check in with them. Are you keeping them in the fold, or are they just off on an island doing their own thing? Modeling strength and vulnerability is a bit of what I talked about before, which is there is no saying the great thing about this is a bad choice of words, but with COVID-19 being what it is, there's no us and them here, right? We're all experiencing these things, whether we're at a management level or at entry level or somewhere in the middle. We're all experiencing those stressors and those challenges and those things. So being able to be a little bit transparent with your folks, not overly so, not over disclosing or laying out your every personal problem you ever had at their doorstep. But again, I'm struggling with my kid, last year when there was distance learning for a lot of us and a lot of our kids were struggling, and you get parents that maybe they're not as productive because they're trying to help their kids in school, like not fail. And it's a problem. And chances are you felt that too. Share it. So really, kind of joining with your folks and also showing some strength in terms of, effective ways to manage things. They might be looking to you for some level of leadership and modeling and trying to do that. The communication, I think we've already addressed, but really the important part here is your communication is two-way. It's not just I'm dictating to you what is. It should be a dialogue. Hey, what do you guys think would be helpful for this problem? And then sharing back and forth, having an open conversation. Most really good ideas in organizations don't come from someone at the very top that dictates something and then commands people to do it. It usually starts organically at the lower level and then gets adopted at the higher levels. Same thing when it comes to employee health and organizational health. Make sure there's an open dialogue there. Show some creativity when it comes to things you can alter. There's things that we can't alter about someone's work day or work environment or work tasks, but there are things that we can. If I got to go pick my kid up for a half an hour, I can adjust my schedule or, tweak those kind of things. Do it. Thinking through not, did you serve your 9 to 5 and punch in and punch out for your lunch break, but did you meet the needs of the organization? Shane mentioned earlier, everyone is always fearful at the beginning that, well, what if we send everyone home to work from home and no one is productive? And really that fear in our organization, at least in most organizations, didn't come true. Turns out giving people flexibility and some creativity and changing some things actually made things more likely to get done more effectively. Know your lane, and by this I mean, we can all be better supporting our people, but you're going to get to a point where you're like, this is above my pay grade, this is outside of my wheelhouse, I don't know. And that's when you want to consult with an expert. I mean, our company does this for a living. It's what we do, right? It's our thing. And it's because we realize that some of these challenges, there are a lot of them you can do on your own and you can manage on your own, but if it gets to be a bigger challenge, you're better off trying to pull in an expert who can really give you the guidance of, what you need and when you need it. The last piece I'm going to mention here is really more of a self-reflective piece. If I'm going to be a leader and I'm going to lead my folks, I need to have a good understanding of myself and what my own vulnerabilities are, right? So I think we've all found over, the course of the past couple of years and most of our lives, if we've been leaders for long enough, there's stuff we're not very good at. And there are things we're good at, and there are things that we really struggle with. If I don't have a good sense of this isn't a strength of mine, and I can't adjust for that, I'm going to struggle to really effectively lead other people. If I don't have a sense of, what my own pain points are in my personal life, I'm not going to recognize it when I see it in my people. So part of being a coach or a mentor or a leader or a manager to other people is being able to look internally and go, how am I doing? What are my strengths and weaknesses? What do I need to work on? There's a lot of rich material there that a lot of us haven't had to sit and think about or deal with. But when we do, when we try and figure some of that stuff out, we actually get much more effective in what we're doing for our organization. So, yeah.
I loved your point about with be creative. That's one thing from working from home is, so say I'm, for me, it's like if I'm stumped on creating something, I'm having just a tough time, and I can just get up and go out to the living room and go play with my cat for like 5 minutes. And all of a sudden I come back and it's like, oh, like I got up, I moved, it's a little just different than having to take a walk down the hall or go grab a cup of coffee. It's a little bit, gives me a little bit more, I I don't know the word, just happiness, I guess, if that makes sense. So I thought that was a good point there.
All right. So if you have an employee who is struggling, again, we've already talked about this. Ask, be inquisitive in an appropriate way. If you have a good relationship, they're going to be open. And if you have someone to consider about, try and connect them with some help. I would say start with your human resources department. Know what resources your company has for folks. Maybe you have different programs, different opportunities, maybe even having an understanding of what the different benefits are that people might have, be that health insurance or employee assistance or whatever it is. One of the things people that need help often struggle with is they don't know where to go or what to do, and so they just don't do it. So it's our responsibility, but also kind of our honor to be able to say, hey, you're struggling, and here are some things I think can help, and help them with that. Don't just say, oh, go talk to HR. Maybe have a conversation, maybe, facilitate it, do something a little bit more active to get them help. And then, directing resources kind of falls within that as well. But, there are a lot of resources out there right now. A lot of the resources, even in private mental health treatment, now telemedicine is not only a thing, it's been a thing for a long time. It's becoming the norm. I can see a psychiatrist or a therapist or whoever without even leaving my desk. It's much easier to get access to some of those things than it used to be. So, you have apps on your smartphone, that kind of thing. So there's lots of resources out there. It's not your job to know what all those are, but do know what's available to your people and be able to talk to those a little bit. Because again, a lot of our people are struggling. And if we can do anything we can do to help get them the help they need in that moment, it's going to help them. And by the way, there's a real business element to this that I think gets missed. And that is all these things like asking how you're doing and directing to resources and doing a warm handoff on some of these things. These are things that will ingratiate your employees to your organization in a way that other organizations that don't do that kind of stuff to them, you're just, those organizations might be just a paycheck. If you can take those extra steps in these cases, even if you don't pay the highest, or even if you make them work a few extra hours, they're going to do that because you care about them as people. And one of the things with, people talk about the Great Resignation, it's not just about pay. I mean, you might leave for a bigger paycheck. You might leave for, personal reasons. A lot of it is my employer doesn't care about me. My manager doesn't care about me. I was struggling and they said they didn't care. If I'm struggling and you're helping me, doesn't mean I won't leave, but the odds of me leaving are much lower if I feel like I'm in a place where I should be and you value me as a person. So just things to be aware of.
Yeah, I know we've got about 9 minutes here, and we'll move on to the next slide, which goes over a few more of these. But one thing I think is important too, and you mentioned it during the slide, is we've had a comment here already today that's like, what if we don't get a response from somebody? And sometimes it's easier to have resources that somebody can go to. Maybe they won't respond to you, but maybe they'll realize, I do need some help. What is a resource I can go to so I'm not talking to my boss? What is somebody I can kind of do that, confidentially to be able to get that help? And being a leader and providing those resources is, I think, important as well.
Yeah. And I'll tell you, a lot of those, Chin, you can skip through. I know there's a little glitch in the animation on this. Sometimes a lot of those things end up in the HR manual. And let me tell you, the last time I read our HR manual, but don't tell my HR manager, never. I've referenced it a few times. If you ask me all of what's in it, I couldn't tell you. So when it comes to that, again, it's not just saying it's in this 300-page document, go find it. It's being a little bit more proactive. When we're talking about, and I'm not going to really spend time on this because I want to leave time for questions, but there's a lot of different things you can do for your folks in your organization, and there are things they can do. And it's just good to be aware that if there is no one option that's going to work for everyone, and there's not only one option. In the olden days, if you had a mental health problem, you need to go find a psychiatrist, or you need to go find a therapist. That's your only option. It's not your only option. It might be your best option in a lot of cases, but there's a lot of other things you can do aside from going to formal psychotherapy 1 hour a week. Just know what those options are. Know what your organization offers. And sometimes people will struggle with, I don't want to, I'm afraid of seeing a therapist, or I'm afraid of this or afraid of that. And, as a therapist myself, I'll get people that will say, I don't know about this medication thing. I don't know if I want to do medications. My aunt was on medications and all this stuff happened, and I don't want that to happen to me. I'm like, just go talk to someone. Ask your questions about it. You don't need to do anything. Just ask questions. Go talk to someone who knows about medications, and ask your questions. And, so again, it's trying to get people to be getting the help that they need. If you're not sure about therapy, that's fine. A lot of people aren't sure about therapy. Do an initial appointment. If it seems weird to you, if you don't like it, you don't have to go back. But you might like it. And by the way, now that you can do it via telemedicine, it's a heck of a lot more convenient and easy. So again, some of that falls outside of the realm of this conversation we're having today, but just be aware of those things. Shane, I know that we just got a couple minutes left here. Any questions that we want to try and hit on?
Yeah, we got a couple in here. We can wait for a few more to come in. I have a couple questions regarding CE credits too, so I'll go over that real quick. This webinar, we are covering a 1 PDC credit for the SHRM certification program, as well as 1 hour credit for the Commission of Case Manager, otherwise known as CCM. So at the end of this webinar, you'll have to, you'll complete a quick evaluation for CCM. And you will be able to download the certificate. It should be at the bottom right of your widgets on your screen. And if you have any trouble downloading this certificate, or any questions for that, you can email us at webinar@r3c.com. So we do have just a couple minutes left. And before we get into questions, I do want to invite everybody to our next webinar, which will be Tuesday, March 22nd. This webinar will feature R3 Continuum's Vice President of Crisis Response Clinical Services, Jeff Gorder. The webinar will be titled The Aftermath of Disruption, How to Create an Emotionally Healthy Workplace. You can register for that today using the widgets and links on the screen, and there will be more information on that sent out soon. So let's get into a few of the questions. And one that came in a little earlier that I wanted to touch on here, Dr. Arvig, is I have been brought in to speak to those who are working on site, often in jobs that cannot be done at home. Despite this, they're still very angry that others can work from home. How can I help them reframe their thoughts?
Oh, that's a good question. The reality is, and again, those of us that work from home kind of lose perspective on this, but most people can't work from home. I don't know if there's a way you can get them to reframe their thoughts necessarily. I think it depends on why they're upset about needing to be on site. And sometimes it's just the sense of unfairness, or I'm at more risk than other people are, those kind of things. But one of the things I encourage for employers that, where work from home is not an option is, what can they do to be flexible? Just because I can't work from home doesn't mean I can't provide some flexibility or some benefit to those that need to come on site. You have to think a little bit harder about what that looks like. But, just because I'm coming on site doesn't mean I should have a uber rigid work style where everyone works from home gets to have a very flexible work style. I personally, and again, I'm one that when work from the office becomes an option, I don't know if I'll go back full time, but I'm not going to be a work from home my whole my whole life. And there is sometimes a sense of the grass is greener for people to get to work from home. And some of those people would tell you they don't prefer it. So that's a good question. I don't have a good answer to it. Certainly it's a challenging situation to get into, but it's I'm sure you did as well as you could given the nature of the question. That's a hard one.
Yeah, the next one here. How do you deal with employees that have anxiety or resentment towards another employee that has left the company?
Also a good one. Look, people leave for a variety of reasons. And some of those reasons are going to be reasons that we're going to know, and some of them are going to be reasons that we're not going to know. The reality is every individual in an organization has the capability of staying or leaving. No one is compelled to stay in the position or the organization that they are in. So, I mean, one of the things I would probably talk about is, it's a personal choice. It's a personal choice that any of us can make. And I understand that, you might be upset that this individual left, and they probably have their reason for doing it. The question is, how do you come to terms with that? Develop some peace with that and be good about where you're at. Because really, if that's making you that upset that someone left, I think you probably need to look at your role and what you're unhappy with. Because ultimately, if Shane leaves this organization, I'm not responsible for that. That's Shane's decision. And if I did the same, so, I can be upset that he left or that he's not here anymore. And maybe it's because there's more work on my plate if they, left the organization. That's certainly a part of it. And that would be something that you'd want to address. But yeah, it's really helping people understand that, everyone has personal choices to make. And there's a lot of people that have made personal choices right now that some of us may not understand.
Yeah. And so I know we've got about 1 minute left here, but this question just came in, and I think it's an incredible question that I want to ask here. So the question is, how do I have more empathy for struggling people at work? I tend to have a suck it up attitude that spills over into how I expect them to act during hard times. Yeah.
I found the same, and I think there's a lot of factors, including, what's your personal style and what's other people's personal style. And it also sometimes comes down to if it feels like everyone is complaining or everyone is struggling. It's one thing if it's one person to show that empathy, but there's something we talk about in psychology or in therapy that's like compassion fatigue or empathy fatigue, where it's just like, I just can't feel it anymore. Like, I don't feel bad. I've seen it so much that it doesn't affect me anymore. And then we develop this, deal with it. And the reality is there are times when that's the message we have to give. But if you're finding yourself in that position, I would sit with that for a minute and think through what's causing it. A little bit about ways you can respond differently. And it might be hard for you to not go to that initial reaction of suck it up and to instead ask an inquisitive question. But it certainly can be done. It's something you can train yourself to do. And honestly, part of it might be, again, when we're struggling with stuff ourselves, and sometimes we're just in that white knuckling mode of just pushing through. That's also what we expect of other people. And it could be that, well, no one gave me empathy or cares about me, so why, so that's how we respond to others. I don't know. But it's a great observation that you have there. And I think a lot of us have felt it. And it's just something we have to step back from for a minute and think through a little bit more so that the next time it comes up, maybe we can change how we respond a little bit to it. I think some of it is, can you find the humanity in the question or the issue? Is it just frustrating you that a task didn't get done? Or can you understand the struggle someone might be having with an elderly parent or something? And if you can get some of that understanding, then that might start to change how you respond. If you can think through, Shane didn't get this done, but why didn't he get it done? And it might be that Shane is lazy, and that might be a situation where it's suck it up. But it might be that there's something else going on for Shane. And I didn't know that, but now that I know that, instead of saying suck it up, I'm like, I do need you to get this done. This is important, but is there anything I can do to support you in it? But no, that's a wonderful question. Thanks for asking.
Yeah, that's seriously. I like you said, I think that's really cool that to notice that in whoever asked that question. I think that's great. So with that, we are a couple minutes over. So thank you everybody for attending today's webinar.